All right. So, as I just said, my name is Racheal. I'm one of the nurse practitioners here at Peak Health Institute. And tonight's webinar is all about inflammation, regenerative health, and how we can help you get moving better. I'm going to share my screen with you. We're going to go over some information first, and then we will answer some questions. Let me figure out how to do that with us first. All right, gonna share our screen here. Beautiful. So tonight's presentation is all about regenerative medicine. Um, Most people have maybe heard this buzzword, but are very confused about what it is, what it can do for our bodies, and how it can actually help us avoid surgery or just push our bodies to that next level that we've been struggling with for so many years as far as inflammation goes. So first we have to talk about what is inflammation and what's actually happening in our body. So when our body responds to something in our system, we often trigger an immune response. Everybody knows our immune system is there to kind of keep us happy, to keep us healthy, help fight off bacteria, viruses, funguses, but it also can become problematic if that immune system can't shut itself off. Okay. In healthy people, the immune system triggers an acute inflammation. So, something that signals out and says, hey, I need help in this area. In people who suffer from chronic inflammation, that constant signal to the body to ask for help does not get shut off. And that's when we end up in trouble. We have chronic inflammatory diseases that stop our bodies from being able to heal. Specifically in the joints, it continues to signal out to the body, and that joint continues to break down. So, again, just to kind of recap, how does chronic inflammation affect your body? So, persistent inflammation is linked to many diseases such as autoimmune diseases, inflammatory arthritis, heart disease, diabetes, and even certain types of cancer. So, when that immune system fails to shut off because its signaling mechanisms are interrupted, it can wreak havoc on your whole body. And oftentimes we miss those early signals and we don't realize until it's too late that we're in trouble. When it comes to our joints, some of the common treatments actually stop this inflammatory process. So, we've all heard of taking medications like NSAIDs or nonsteroidal anti inflammatories. These are going to be those medications like your ibuprofen, naproxen, Aleve, or even aspirin in some cases. These medicines are great for the acute phase, meaning they're going to stop that pain right away, but they're not going to do much to shut down that immune system response. And ultimately, the more we take these, the more it can lead to other problems throughout the body. So, with the NSAIDs, we can get stomach ulcers, we can increase our risk of heart attacks or strokes, and it can even impair your kidneys. When it comes to joints, also a very common treatment if you go to the orthopedist will be a steroid injection. Again, steroids are a really powerful anti-inflammatory, so they're going to be a short-term fix for the pain, but they're actually not going to do anything to fix what's actually causing the pain in the first place. So lots and lots of research studies that are out there that say, yeah, the steroid helps in the immediate, but over time, the more injections that we get, the more damage we're actually causing to the cartilage or even some of the supporting ligaments that are around our joints. I hear this probably at least 5 to 7 times a day. where somebody says, I went to the doctor, they gave me a steroid injection. The first one worked great. It lasted 3 to 6 months. Second one was okay. It worked for a little bit. By the time they're on round three of these steroid injections, it's not doing much for their pain anymore. And so now they're starting to talk to their orthopedist about maybe even having surgery. The other thing is, temporary fixes are some of the painkiller medications. And with the way of the world now, we just all know how bad those are. So anything we can do to stop somebody from getting to that point is going to be beneficial for just our overall health and wellness. So great news though, and that's really what the focus of this webinar is going to be tonight is we have options for you. One of the simplest options that we focus here on at Peak is actually fixing that gut microbiome to help the immune system work a little bit better. That's going to take some time, that takes some commitment, that takes some real investment in your health, but it can make things so much better and make you get up and move leaps and bounds from where you are today. Sometimes we need some additional help. So this is going to be in the form of some sort of regenerative medicine. We have a plethora of tools in our toolbox that we can kind of help fine tune what your body needs. Some of these injections include Prolozone therapy, platelet-rich plasma therapy, A2M therapy, using Wharton's jelly or exosomes. These are umbilical cord derived cells that actually help to regenerate some tissue. So we'll go through each one of these one by one and kind of go through the differences and how it can work into your plan. So the very first one is what we talked about is that leaky gut. When the gut membrane becomes permeable, aka it's got some holes in it, it lets some of that bad bacteria out into the bloodstream, which causes inflammation, which causes all of the body systems to have to work even harder than they're already working to repair damage that we're exposed to every day. This is going to be a long-term fix so that way we can help the body just work better and more efficiently from the inside out. Leaky gut can help joint pain because it can decrease inflammation, which again will get that immune system to calm itself down a little bit so that way we don't feel it as much as in our joints. It can help some hormone regulation as well. And hormones play a really big factor in our joint lubrication. But we'll focus on that on another webinar. But just know that that's one of the things here at Peak that we really specialize in is trying to get that gut microbiome and the body to function well overall. So the way that we test for leaky gut syndrome is we've got a variety of blood markers or stool markers that we can look at to see where we actually need to help and help focus on your body to repair that leaky gut. We can help target treatment and put together a plan that works just for you. But again, that's one that takes some time and requires some commitment from you as far as being consistent and being invested in your health. One of the injectable treatment options that we can offer for joint pain is something called Prolozone therapy. So Prolozone therapy uses a combination of both vitamins and O3. Everybody's heard about the ozone, and it kind of gets a bad rap because we think about it as the black hole that's up in the sky. But when we use it for medical uses, we're really trying to kill off any bacteria, viruses, fungus that may be trapped in those joint spaces. When those microbes get trapped in the joint spaces, that's when the body's constantly sending out that inflammatory signal to try and get somebody to come in and help and repair that tissue. With Prolozone therapy, we create a controlled inflammatory response, tell the body, open up blood flow to this area, And with the use of that supercharged oxygen molecule, we can actually help kill off some of that bacteria, virus, or fungus that's kind of eating away at that joint, triggering that inflammation over and over again. It doesn't use any cellular product or anything like that. It does rely solely on your body to come in and do the work. So there's no real medications involved in that repair process. With prolozone therapy, it can take a few treatments to really get that relief. But over time, patients report that they're able to move better, they're able to get up and go better, and they don't have as much achiness in that joint because we've actually called the body in there to do some repair work for you. Treatment for this option often requires 10 to 12 treatments, usually 2 to 4 weeks apart in your care regimen, but we always make an individualized plan just based on what your symptoms are. So that's a good option for us. And you'll hear me talk about good, better, and best. And prolozone therapy is a really good option for us. A next step up from that, again, asking your body to do some work, is something called platelet-rich plasma therapy. So in our body, in our whole blood, we have a couple different components. One are the red blood cells. They carry our oxygen. They carry some of our minerals, our iron. They're really good at feeding the cells. Another key component of that, though, is the plasma. When we take your blood and we separate it out, there's a distinct separation between red blood cells and plasma. And within that plasma, there are hundreds of different types of growth factors that will, again, create that controlled inflammatory response, but then signal out to your body that says, hey, I've got some helper cells here. I need you to come and put them to work because they're asking for you to build something new. Okay. Plasma is only good as the donators, though. So the older we are, or the more inflamed we are, or the more poor health or chronic health conditions we have, plasma might not be the best choice for you because your plasma is already working a little bit harder in the background. Plasma is fantastic for my younger patients who have really good healthy lifestyles, who are really dialed in on their diet, aren't really inflamed, but maybe they were playing a sport and they have a musculoskeletal injury that we just need to accelerate that healing for. Plasma is going to work really great for those patients to try and get some extra healing and in a more expedited amount of time. Treatments for platelet-rich plasma therapy are usually a series of, at minimum, 3 treatments, again, usually 2 weeks apart. And then we wait. We give the body time to actually rebuild and regenerate some new tissue and new blood flow to that area so those healer cells can get in there and do their job. Another better option for my patients who are suffering with arthritis is something called A2M therapy, alpha 2 macroglobulin. This is actually an enzyme that we already have kind of circulating around our bloodstream. This enzyme is really great at telling that joint, stop eating yourself. So basically telling it to stop breaking itself down. The very first question I usually get from people is, if we have this in our bloodstream already, why isn't it doing the job in the joints that you're asking it to do when you take it, separate it, and concentrate it? The answer is, in short, it's just not concentrated enough in its own bloodstream all by itself, is problem number 1. Problem number 2 is our joints just do not have great blood flow to keep the healing process happening. So when somebody suffers from arthritis, the initial injury allows blood flow to open, but then the body becomes like the boy who cried wolf, and it figures out that the injury is just getting worse and worse and worse. And so it will close that blood flow. Once it closes that blood flow, some of those cells that are in there are then just too large to escape again. And when they're too large to escape again, They just keep eating away at that joint. So the scientific word for that is the joint becomes catabolic. So we don't want that joint to keep eating itself away. That's where arthritis gets its, progressive disease state name from. It's because those cells get trapped in there, they can't get out, and the joint keeps breaking down. With A2M therapy, again, another controlled inflammatory response, we're going to open up some blood flow. We're also going to neutralize those giant cells that are eating away and breaking down at that tissue. When we super concentrate this enzyme and inject it into a joint that has arthritis, we can kind of lay a fertilizer or groundwork for the body to be able to calm itself down and actually start some repair work. This therapy is paired great with other regenerative options, again, because it's going to stop that joint from eating itself and allow some of these other therapies to actually rebuild and regenerate new tissues. Treatments for this is usually a one-time treatment, and then we wait a few weeks. We let this A2M go in there and put out some fires, neutralize that joint, so that way with the next product we come in with, it can actually start that repair and healing process. So the best option that's out there for, I'd say, the majority of our patients is something called Wharton's jelly. This is something that a lot of times you'll hear people talking about stem cell therapy. Usually when they're talking about that, they're talking about this Wharton's jelly complex. So the very first question I usually get is, where does it come from? Wharton's jelly comes from the inside of the umbilical cord tissue. So if you think about the inside of an umbilical cord, like the outside wire, a covering of a wire, inside are the arteries and the veins, and then the cushion that covers those is this Wharton's jelly complex. Wharton's jelly never comes in contact with any blood from the umbilical cord, from the baby to the mother. So the beautiful thing about this is it does not have to be type specific, meaning if somebody has A positive blood, we don't have to worry about the Wharton's jelly being A positive, like a blood transfusion, because they don't have those blood types mixed in with this complex. This type of treatment can be applicable to anybody. Okay. The beautiful thing about Wharton's jelly is it's able to do quite a few things. The simplest way I explain it to people is it's like putting all of the construction material at the construction site and then just calling out to the body and saying, hey, I'm ready for you to bring the workers. Okay. So Wharton's jelly has not only those growth factors that were in platelet-rich plasma, but it's got messenger cells called mesenchymal cells or mesenchymal cells that will tell the body, I need somebody to come and get rid of this garbage. I need somebody to come and repair this tissue that's damaged. And I also need somebody to come in and regenerate new tissue because I've lost some here. In addition to that those mesenchymal cells or mesenchymal cells, the Wharton's jelly complex has natural hyaluronic acid. So it is fantastic in giving that joint some cushion right out of the gate. That natural hyaluronic acid is different than the gel injections that a lot of people get for their knees. The gel injections are generally made synthetically in a lab, or they come from a rooster comb. That's why the body recognizes these as foreign, and these injections have to be repeated in a series, maybe 3 or 5. And it's because it takes the body some time to realize that you're intentionally putting this foreign substance in there. With Wharton's jelly, because the hyaluronic acid that's in there, the body already recognizes its chemical compound. It's not going to try and break it down at all for you. It's just going to put it to use right away. The other great piece about Wharton's jelly is it's got those growth factors that were in the platelet-rich plasma. And it's got the ability in some of these growth factors to actually differentiate the type of collagen that's specific to our joints. So everybody knows about collagen for your face, your hair, your skin. Those are collagen types 1 and 3. Inside the joint for our cartilage and for that synovial fluid, we actually need collagen type 2. That's extremely hard to get from our diet, but Wharton's jelly has the signaling factors to be able to differentiate and give that joint collagen type 2. Okay. The other part of Wharton's jelly and what makes it kind of the best treatment is it releases exosomes. Exosomes are tiny enveloped messenger cells as well. And their main goal is to, again, put out some of those inflammatory fires. They're my firefighters. So they signal out to the body and say, I need a little bit of inflammation here because I need to start some repair process, but I don't need you to send the whole Calvary because I have half the stuff I need already. So with Wharton's jelly, again, it's like putting all of your construction material at the construction site, and all you have to do is call in the workers. So it is the best as far as regenerative medicine and healing the actual tissues go. So usually we ask, people ask, what can it be used for? And to be fair, Wharton's jelly can be used for any joint space, any trigger point injections. So a lot of times when people have low back pain specifically, we can put this Wharton's jelly complex in the facet joints or the little spaces in between each disc, give that joint a little cushion, calm down some of that nerve firing with the exosomes, and then help the body to rebuild some of that space so the disc can kind of call in some moisture so it doesn't keep getting dried out and damaged. So it is a fantastic kind of one-stop shop to get everything where you need it so the body can replace that tissue. Generally, for treatment for Wharton's jelly or any type of cellular therapy, everybody's treatment protocol is going to be a little bit different, and that's just dependent on how bad your injury is. For most of my patients that are moderate to even severe arthritis, it's going to take more than one treatment to be able to start that healing process, get blood flow to that area, and then really see and feel some of the effects that this Wharton's jelly can do for our bodies. It's another one of these things that takes time, though. We have to give the body an opportunity to repair some of this tissue. Very different kind of medicine across the board when we're talking anything regenerative, because we are used to medicine and healthcare where we have a pain, we get a treatment, and the pain goes away. This is different. We're going to have some relief, but real results really take 3 to 6 months before we're seeing kind of where we're going to end up at. So based on the severity will depend on how many treatments we need and how powerful and strong we need a punch we need to pack. Right. And the very last piece, as I kind of bridged into this a little bit, is exosome therapy. So as I mentioned, the Wharton's jelly has a small amount of exosomes in there, but if we are really looking to calm a lot of inflammation, systemic inflammation, autoimmune inflammation, exosome therapy is going to be really what we need to kind of start that groundwork. Okay. Exosomes are the only particle within any cellular therapy that can actually cross that blood-brain barrier, which makes it fantastic for nerve issues, people who are having cognitive decline, or even just looking to decrease and downregulate that immune system. Exosome therapy can be a fantastic option for patients who need that type of treatment. Again, everybody's treatment when it comes to any type of cellular therapy is going to be very individualized, because we need to figure out, number one, how your body responds, and number two, how much punch do we need to pack in order to get you feeling better. The unique thing about exosomes is we can absolutely put them in a targeted area. So if we have a shoulder that's really inflamed because we have a recent rotator cuff tear, exosomes is great for calming down some of that inflammation, which will give us some pain control. And then we can follow up with some Wharton's jelly, which will be some construction material to help heal that muscle and that tendon tissue. Same thing with those knees. Knees are very common. I have a lot of my patients come in and say, I just moved a certain way and my knee blew up 100 times more than it looked like the other day. We need to start that patient with some exosome therapy. Again, let's calm a little bit of that inflammation first, but then let's follow through with giving some building blocks to help that joint be able to function a little bit better. The other great thing about exosomes is we can use this as an IV infusion. So patients with autoimmune diseases, chronic Lyme infections, mold, anything that's really triggering that immune system, and we can try ozone therapy with that as well. But if we're really looking to kind of pack some punch and really kind of take our bodies past the point, if we're stagnant, exosome therapy is a really great option because it's going to go in there and retrain that immune system on how to respond to things. Okay. The other way we can deliver exosomes is actually through a nebulizer. Again, because these vessels are really small, they can cross that blood-brain barrier. If you breathe them through the nasal mucosa, they can get to the brain a little bit faster. So this is really helpful for my patients who are suffering from maybe some early signs of dementia, early signs of Alzheimer's, any cognitive decline. Nebulization of exosomes really helps to protect those neural pathways so that way the body can continue to send those brain signals and actually can halt and make cognition improve. Okay. So those are all the treatment options that we offer here at Peak. Um, Again, everybody's treatment course is going to be a little bit different, but the best thing I can tell you is to come on in. Let's have a consultation. Any imaging you have, any CT scans, MRIs, or X-rays you have, let's talk about it and let's talk about how we can improve your life and get you moving, because there are tons of studies that are out there that show once somebody stops having the ability to be mobile and exercise and move their body the way that they're supposed to, your brain starts to decline, and then we're kind of spiraling that drain of, living a non-fulfilling life. We know too much now than to settle for that. We have too many tools at our disposal, so that way we can help and kind of figure out what your treatment course should be. Okay. All right. So we did have a couple questions. So we're going to stop sharing now, and I'm going to pull up those questions. All right. So one of the first questions I have, I think I touched a little bit on while going over the different types of products that we have, is, are there any tools that are effective in mitigating sciatic nerve pain, or any therapies that will help sciatic nerve pain? And the answer is yes. So, sciatic nerve pain is often triggered from that low back area. Most people think that since the sciatic nerve is kind of in their bottom, they feel that they feel that burning or a hot fire poker in the middle of their bottom cheek. Um, that's where the irritation is. But the reality is it starts in that lumbar five area, right by that tailbone. All of those nerves that come off and feed down into the leg branch off of the spinal cord right there. They wrap around like a really thick licorice rope and they sit right under that glute muscle. when that glute muscle is trying to protect that low back because we're losing some spacing, that's when that sciatic nerve gets irritated. So, treatment that can be really helpful is using a combination of number one, exosomes. Let's calm down some of that fire that's around that nerve. And then let's give it some cushion. Let's give it some building blocks so that nerve can stay free and it can stay in its pathway. So, regenerative medicine is really helpful in opening up space so the nerve doesn't continue to get irritated, which in of itself can help with some sciatic nerve pain. Okay. So great question. That's one that I see super common. And usually it takes a series of two or three, and adding those exosomes in there to calm that nerve really gives us that, not immediate, but a couple days in, pain starts to subside. Okay. The next question we have is, how effective are injections for knee pain if you've reached the bone on bone stage? And the answer to this is that bone on bone that everybody keeps telling you about, that's been going on probably for the last 7 years or so. The pain comes from an increased irritability on those nerve pathways and because of that chronic inflammation. So I don't necessarily treat an x-ray. I treat the function and how you feel. And we oftentimes, with the combination of A2M therapy, kind of slowing down that arthritis or neutralizing that arthritis, and with these stem cells or the Wharton's jelly, creating some cushion, it can absolutely bring back some of that cartilage, bring back some of that meniscal tissue that's damaged, and help support the ligaments around that knee so that way we can function pain free. Okay. There are lots of great studies out there that show that even function is more important than anything that an x-ray can show. Okay. Generally, though, when you see an orthopedist and they tell you you're bone on bone, their next question is, when do you want to schedule surgery? And the reality is that's not the only option. Is we have options to either A, if you are really to that stage where you're like, I know I need a knee replacement, but I have 75 other things going on in life right now. I can't take the downtime. We know these treatments are going to give you the mobility to be able to take care of life events or even starve off surgery for an undetermined amount of time. Really, your lifestyle will depend on how long these treatments last. I have some patients who are 3, 4, 5 years out, who are just now coming back because the knee is whispering to them again. They take really great care of their body. We did a really aggressive round of some regenerative medicine treatment, and they did great for a really long time. On the flip side, I have some other patients who, don't take the best care of their body. They aren't as mobile, and they're one of my patients who need almost like a every year and a half, 2 year booster. And that's okay, because once we kind of fix the cavity, so to speak, then we just need to kind of keep up with some regular cleanings with it. And that can keep, again, starve off surgery for an indefinite amount of time or forever. But how your body responds is really what helps determine that. So really, really great questions, and knees are kind of one of the most common areas that we treat. Another great question is, can the regenerative medicine help with rheumatoid arthritis pain and swelling? So rheumatoid arthritis is an autoimmune disease. It's the immune system reacting to the signals that the body is sending out. And absolutely, regenerative medicine can help this. Prolozone or ozone therapy, as an infusion, can help calm some of these inflammatory fires. So ozone therapy is a fantastic option. If we fail with ozone therapy, we're just not getting the most bang for our buck that we think we should get. Exosomes are another great option. They're, again, those teeny tiny vessels can actually get inside to some of those little crevices and calm that inflammatory fire, retrain the immune system on how to react, which will for sure help that swelling or any inflammation that's going on that's triggering some of these physiologic responses. So, really, really great questions. Again, I would love to speak with any of you guys and have a consultation on how these treatment options can help you get you moving and feeling better. And then, because you guys are in this webinar today, and if you've registered, we can offer you a free 15-minute discovery call. And there were some bonuses or percentages off that we were offering our patients for attending the webinar as well. And that's going to be anywhere from 15 to 20% off of the treatment packages that we put together for you. Okay. And let's see, I'm just checking to see if we had any other questions here. All right, one very great one. And another question we got is inflammation caused by what I eat? Answer is it probably is. But a bigger question is, why is your immune system responding that way? So part of the workup that we would figure out is it because we have a sensitivity to some foods? Is it because of what we're eating? A lot of times sugar is the main culprit for inflammation and inflammatory responses. Sugar causes increase in our insulin because it just can't get that glucose molecule out of our bloodstream. And I always say when the body needs to trigger more insulin, it's kind of like having a toddler run around your house with a steak knife, just tearing up your freshly painted walls. Insulin is so inflammatory to our bodies, it can cause a lot of damage. And oftentimes, those insulin spikes are due to what we're eating. So, absolutely, what we eat and how we fuel our bodies can either help or um, aid to some inflammation. So, great question. And one of the other ones that I have is I have joint inflammation due to Graves' disease. Could regenerative healing help me achieve remission for my disease? So that's a great question as well. So thyroid function and how that thyroid is giving us in Graves' disease, case too much of that active thyroid hormone. Part of that is figuring out why. What is causing that misfire of those thyroid hormones? Is it due to inflammation? Is it due to leaky gut syndrome? Is it due to an overactive immune response? But part of figuring out Graves' disease is we've got to figure out why that thyroid is misfiring. A lot of times that can be due to inflammation, but getting to the root cause of what caused that inflammation in the first place is square number one for that. Once we figure out that treatment, then absolutely, this is where those exosome infusions would come in. So that way we can retrain that immune system and tell it how to respond to some of those signaling hormones that are telling that thyroid to be overactive. So yes, in short, regenerative medicine can help, but a bigger picture for somebody with any type of thyroid dysfunction, whether it's hyperthyroid or hypothyroid, we really need to figure out why that thyroid started to misfire in the first place, and kind of figure out how we can calm that storm before we just throw regenerative medicine at things. So very, very great question. All right. And then, a lot of times, one of my other specialties is actually dealing with perimenopause and menopausal joint aches and pains. this is another area where we can use exosome therapy as an IV infusion to actually help the body make more hormones, respond to hormones better, and kind of alleviate some of those hormonal symptoms that 100% are not just in your head. We know too much. Again, we know too much now because of the science and the studies that are out there, how much your hormones, estrogen, progesterone, testosterone, really do play a big factor in our overall joint health, in our inflammatory response, and just kind of our body's ability to stay functioning at its optimal level. One of the really great research studies that's out there now is the direct correlation between something called our follicle stimulating hormone and the increase in osteoporosis. So the higher that follicle stimulating number is, and the increase in osteoporosis is directly related to not having enough hormones. Follicle stimulating hormones is released by the brain. It sends a signal down to your ovaries and it says, I need more estrogen. Can you make me more? And so it keeps pushing on that gas pedal. That number goes up, 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 but the body just can't respond anymore. Our ovaries just don't have enough squeeze to give us. When that follicle stimulating hormone goes up, the body will say, well, if the ovaries aren't giving it to me, I've got to find it somewhere else. And so it starts to go to our bones. So hormone replacement and hormone optimization, again, is not just all in our heads. It's not just menopause that we have to wait to get through. It can actually have a really big impact on your inflammatory response, your joint aches and pains, and the way that our body moves and its ability to keep on that lean muscle mass that we know protects those bones. So, a lot of moving parts when it comes to joint pain and inflammation and overall wellness and optimization. Um, this is where we at Peak are just a little bit different. We don't just kind of chase those normal values. We really want your body to be optimized. So we've got to get to the root cause of things. And then we've got to put together an individual plan just for you, because this is not cookie cutter medicine. This is everybody is different. And once we can find how your body works and what works for your body, that is where we can get you feeling the best. Okay. I'm going to check the chat here, see if there was any other questions. I don't see any other questions in the chat. If you guys have any, you can put them in that chat now, and I'll wait a couple minutes to see if there's anything else we can answer for you. And I know I just threw a lot of information at you guys, a lot of science, but this is where that discovery call will come in super handy so we can talk about your specific case and kind of what options that we have for you. And again, a perfect time as being part of this webinar to take advantage of some of these discounts and getting you scheduled and really just getting you on the path to feeling your best, because I know I say it probably 100 times a day, but we definitely know too much now. There's too much science in there, a lot of great studies out there, and how we can get our bodies to work better for us. We don't have to, be like the Golden Girls who are, when they were on the show, they were in their 40s, and we know that they looked a lot older than that. We don't have to do that. Okay. Oh no, it said the chat was disabled. Let's see. Chat settings, show chat preview. Okay. Let's see. Go ahead and try the chat now. Kind of opened it up to everyone. Hey, there we go. Thanks, Lisa. Perfect. All right. Any questions, guys? Perfect. Thank you guys. And again, I know it's a lot of information. Yeah, so Chiari, that's one that's super tricky because that has to do with a lot of that intracranial pressure. And that's what's pushing the piece of your brain out, which causes a lot of headaches. The best thing as far as regenerative medicine that I've seen work for Chiari, and again, it's one of those ones that's super complex just because of the fluid pressure changes, is actually nebulized exosomes, calming some of that inflammation within that skull cavity and around those brain and around the neurons. Um, Nebulized exosomes can help directly get to that brain, which can help relieve some of those Chiari headaches. Because if you suffer from that, gosh, you know that there is no amount of pain medicine that can take those headaches away. You just want to crawl in a dark hole and not come out. So anybody who suffers from Chiari, I mean, my deepest condolences, because it's rough and a lot of things it's tough to find the triggers for it, what makes those headaches come on. But I will tell you, nebulized exosomes are probably one of the only things that I've seen work in an outpatient setting that people have gotten some relief, and not just relief that's short lived. I'm talking maybe 3 or 4 months without a Chiari headache. And they were like, I got my life back. I didn't have to, wonder if the sun was going to trigger me and I was going to be in a dark room for 10 days. So that's a really rough one, but some of these infusions and nebulizers are going to be the best way to try and get at some of those, just an inflammation within that brain. Very, very great question. All right. Well, thanks, Nicole. I know you came in late, but if you have any questions or anything comes up, I'd be happy to answer for you. Or if again, there's still things that you want answered after the webinar, we are recording this, so it'll be, we'll put it out so we can replay this, and some patients can you can rewatch it, a lot of the science of it. But if there's anybody that you think would benefit from some of this information, please feel free to share. Again, I'd love to have a perfect. I'd love to be, even just have a discovery called and just kind of go over some options for you. And then we can go from there and see how we can help. All right, guys, if there is no other questions, then we can wrap this up, let everybody get back to their Monday nights, and I'm sure dinners and sports and laundry and all the other things that we do. But again, if there's any other questions, you can always schedule that free discovery call, or just please share this information because it's so helpful and so many people just don't know about it. All right, thanks a bunch, guys. Have a great day.